We're much fewer.
Yeah, that's much fewer.
Well, where's everybody?
Maybe we should do it after the talk.
Good.
Yeah. That's important. See whether anybody's out there. All right, guys, I hope you had a great lunch, and we'll continue now. And it's my pleasure to introduce Giulia Celora from University College London, and also collaborators from Oxford and UMass, talking about the impact of intra-tumour heterogeneity on radiotherapy.
Okay, thank you very much. Can you hear me properly? Yeah, I guess so. So first of all, I'll thank the organizer for giving me the opportunity to talk today. And I'll give a little bit of a disclaimer. I don't work on evolution per se, but I hope there are some overlaps with some of my previous work with what this workshop is about. And so this work is work that I've done during my PhD when I was in Oxford, together with Ellen Byrne, who was my advisor, and Panos Kevrakidis, who's based at UMass Massachusetts. And the organizer have been very charitable, so they gave me a lot of time that I was not expecting. So my original thought was to talk to you about modeling the impact of intra-tumour heterogeneity of radiotherapy outcomes. But since I have a little bit of time, actually, let's see. My talk would be start a little bit earlier on in this project. I would be in general about modeling phenotypic heterogeneity in solid tumors to start with then the application to radiotherapy. And so in general, as we all know, treatment failure in cancer is often associated to heterogeneity. And the idea is that tumors, we became very good at treating most of the tumors, the bulk of the tumors. But the problem is that there are the few cells that are left behind that are resistant for various reasons to treatment, and they don't die, that eventually drive recurrence. And so our general goal with this work, with this and other work that I did, it was to use a mathematical model to try and understand how heterogeneity in the tumor microenvironment can aid the resistance of cells by shaping their phenotypic traits, and using this mathematical model to try and understand general principles that can guide us in the development of effective treatment strategies. So I'm not on this talk is not going to be on the data-driven side or clinical side. It's a very theoretical work, but I hope that it can shed light on how mathematical model can help us understand general principles that then we can apply there. So why oxygen level, and in particularly hypoxia? Well, we know that tumors are a macroscopic mass and tissue that form within the system, which are highly heterogeneous when we look at the microscale because of the vessel structure. And the idea is that unlike in normal tissues, because of the imbalance between proliferation and supply of nutrients within the tumor, we have the formation of region with pathologically low oxygen levels. And that's what we call hypoxia. And people have been really interested in hypoxia because it's been associated to, first of all, poor treatment outcomes, and several of those traits that we do associate with resistance can aid tumor progression. And there are several of them, some of which people in the room have worked on. For today, I want to focus on one specific aspect, that is stemness. And the idea is that these changes in the individual cell behavior then affect the macroscopic dynamics. And I think mathematical modeling and different coarse graining techniques and multi-scale modeling approaches can help us understand the connection between this multiple scale and multiple temporal scale from a mechanistic point of view. So the rest of my talk is going to be divided in two parts. The first part is going to be generally on using mathematical modeling to understand the role of oxygen in shaping cancer growth and composition. And the second part is going to be my original talk, which is looking at how we can use the insight from this model to try and inform treatment strategies, and particularly radiotherapy. And so the key message from the first part is a little bit of a spoiler, but hopefully it's going to help you following and as go through, is like space really matter. And we saw this morning as well. Space can change. And in this case, most of all, heterogeneity in oxygen level can drive more complex dynamics. And then from the second part is that how we can use, how we can design treatment that actually help us not only counteract phenotypic heterogeneity in tumors, but actually exploit it maybe to gain more effective treatment outcomes. And one of the key findings that we have is this idea that treating the sooner is not always the better. And this is the idea of treatment holidays that we see all over again when we think about evolution of phenotypic heterogeneity in tumors. Okay, so before that, I'll start from part 0, because as I said, this work is mainly looking at one specific aspect of trait of these cells, which is associated with poor lower sensitivity to treatment, which is stemness. And so the idea is that people have noticed that even in solid tumors, so not hematopoietic type of cancers, there is this sort of hierarchical structure where they can identify what we call cancer stem cells that are highly resilient and resistant to treatment. And they usually have, they might be proliferative or quiescent. These then can differentiate in what are known as differentiated cells that are highly proliferative, and this composes the bulk of the tumor. And these are the cells that we're really good at targeting and killing off with the current treatment strategies. And these eventually get exhausted because of their differentiated nature, and they become kind of senescent, they die eventually. And so their proliferation is really low. Now, there is a lot of debate in the literature on what actually these stem-like cells are, because as I said, we're not looking at blood, there is not a specific hierarchical structure, and there are lots of different kind of markers that you can use for stemness. And so when people look at cancer cells from patients and they try to find this stemness signature, what they find is that actually you don't have a dichotomy, you don't have 3 compartments, you actually have a continuum of states in which cells are in. And this goes back to the talk of this morning, is that cells don't really like to be put into boxes. There is lots of variability between their behavior. And so it's kind of difficult to reconcile this new type of data where we see like all of this variability in the expression with a more compartmentalized models. And so what people have really been thinking about is that rather than having like individual compartments, maybe actually the cancer cells can live along a continuous on these stem-like kind of properties. And so this is going to be the starting point from this work. Okay, and now stemness is, as we said, is a continuous trait, but also what people have realized is that cancer cells have developed mechanism to hijack these programs. So they can actually use that at their own aid, most of all when they're faced with like difficult environments. And this is where hypoxia comes into play. Hypoxia, low nutrients is very stressful for cells. And what people have observed is that in the presence of low oxygen level, cancer cells tend to dedifferentiate, so to acquire more stem-like traits. And so this is actually a plastic trace that can change and adapt to the response of their environment. And this is the other key ingredients of this work. Okay, so now how can we use mathematical modeling to try and understand how what I've just told you affects tumor growth and composition? So the first part we'd be looking at model 0101, as we saw this morning, absence of space. Let's start simple. And then afterwards are gonna see how what we learned from the spatially homogeneous model actually translates in a spatially heterogeneous environment. And so here, when we think about a homogeneous environment, what you can think about is basically a cells in a petri dish. It's like more of a in vitro type of condition where the oxygen is externally prescribed. And so when you look at cells now, you have the cells can don't live in boxes, but live along a continuous. And so you describe them by this phenotypic distribution. So here I'm assuming that our phenotypic trait goes between S equals 0, which is the highest stem-like, to S equals 1, the more terminally differentiated state. And this function S tells you at any given time point the number of cells that have a certain trait S. And so we want to describe how does this distribution evolves over time. And so as we saw this morning, one of the key features of this type of model is cells are proliferating, they're undergoing selection. And so we have the standard proliferation and death. And we have a competition term that here comes in by this integral, because it's the density, the total amount of cells. Cells are competing with all of the cells surrounding them. And they proliferated die at a certain rates that depends on their phenotype and the local oxygen environments. And then we need to describe how cells actually evolve in this phenotypic space. And here we use a standard term usually used in the literature, as we saw, as Donald mentioned this morning, which is this first diffusion term. And here we're kind of capturing kind of random variability between cells' behavior. So this is random epigenetic changes, but you can really think about it as small variability. And then we have an additional term, which is actually capturing the role of the external environment and the adaptation of the cells. And this corresponds to an advection term that determines a more of cell reprogramming type of behavior. And this is, of course, is coupled with the boundary condition and initial condition of your sort. And so just to look back a little bit at the model itself and what are the different terms, Donna did a great job this morning, and so it's simplifying my job. But so the key idea is that we have this advection term. And as I said, this is kind of modeling cell reprogramming. And so the idea is that in high oxygen levels, cells lose stemness. So they don't feel, they're not threatened by anything, they're happy, they can proliferate, and so they differentiate. While in the presence of low oxygen, where cells actually are lacking nutrients, they, for whatever internal gene regulatory networks that is happening, they reprogram and they acquire more stem-like states that allow them actually to survive in more challenging environments. And so if you were to neglect the proliferation terms, what you can think about here, more from a physicist perspective, is like you have a kind of energy landscape and you're trying to minimize your energy. So you kind of go in those states that kind of leads you to a minimal energy. But then we have the other term, proliferation and death with competition. And this, as we saw this morning, is kind of a standard fitness type of game where it's the one with the highest proliferation rate is the one that is going to dominate. And this type of equation have been used and studied a lot in the literature by Lorenzi, Pertam, Dickman, and others, and they are associated with this idea also of adaptive dynamics. And so here in the model, really, we have these two key mechanisms and ingredients. One is cells adaptation. They might not be linked directly to gaining a fitness now, but it might lead to this cellular reprogramming, might lead to higher fitness in the future and survival. And then the standard natural selection, which is just given by, am I proliferating more than my neighboring cell? So now, as I said, we are using partial differential equation type of models. It's not in ABM. And what is nice about it is that we can actually study the structure of this equation and get some more general insight. And so we started with some dynamical simulation. And what we saw is that eventually the system relaxes to a steady state with maximum carrying capacity. And so we want to characterize the steady state as a function of our parameters. And so what we find is that we have two classes of steady states. One of them are the phenotypic homogeneous steady state, so the one in which there is no dependency on S. And here we have just one possibility, which is the trivial steady state, so actually extinction. So you don't have any cell left. And what we find is that if you do all of the analysis, we find that in high oxygen level, while cells are driven towards differentiation, the trivial solution can be linearly stable. And this is if the velocity at which cells differentiate is sufficiently high. So if basically cellular kind of adaptation differentiation dominates over natural selection. In contrast, if we look at the case in which cells are exposed to hypoxia, so now we have this dedifferentiation mechanism, you do have that the tumor grows slower, but eventually it will always grow back because you have these few cells that are eventually gonna survive nonetheless. Okay. And the details of the maths that I'm not giving here can be found in the paper.
Can I ask a quick question?
Yes. Yes, of course.
So what is the meaning of carrying capacity or steady state in a tumor? Because it seems to be that the competition depends on being a steady state in this.
Here we're kind of normalizing it. So the growth of the tumor reaches always a value that is less than 1. Here is normalized by whatever is the standard, I think 10 to the 10th cells or something. So the idea is that here the carrying capacity is 1. The maximum carrying capacity that you can get is 1, but then depending on the parameters, you might arrive to a fixed value, which is more or less than 1.
So what if you get rid of the carrying capacity and have a continuously growing population? Because tumors are kind of continuously growing, rather because steady state interpretation is either the person dies or never gets sick.
What you can do is actually you can use the ansatz. It's actually the two are related because so basically, if you use the ansatz on an exponentially growing population, and then you look at the fraction of each phenotypes, you can go back to a similar analysis, actually.
Right, but there's then no direct competition, right? If you have an exponentially growing population between the types, because they both grow independently exponentially.
Yeah, you just have like the one that grows like faster.
Right,
is like you're not affecting the growth rate of your neighbor, but you're just growing. You're keeping on growing. Yeah.
Yeah, so I was just wondering how that.
No, definitely. But in some way, at the long time scale, when in this exponentially growing population that have different phenotypes, usually you can always go back to look at the fraction of each phenotypes, and then you go back to a similar type of equation, actually.
Yeah, thank you.
But that's a really good point. There are lots of assumptions here, of course. And also, like when you look here, basically, when you look at the linear stability analysis, you're actually looking at the case in which you are below carrying capacity. And so you actually look at the linear equation. But then we have also other type of equilibrium, and these are phenotypically heterogeneous. And this one, depending on the choice of the function v and your proliferation rates, might be computable or not. In this case, they're not. And so we actually use numerical bifurcation techniques to try and understand and study the equilibrium problem in this case. So starting with high oxygen, so we have our proliferation profile, we have our velocity profile with a maximum differentiation velocity V+. And now what I'm gonna show you in this plot is the equilibrium solution as a function of your parameter V+. So the velocity of the adaptation, and on the y-axis, I'm basically just giving you a functional of my solution, which is the total amount of cells in the system, so the kind of tumor burden. And so, as I said, we have one solution that always exists, which is the trivial steady state. But as I mentioned, when the velocity of adaptation is too high, this transition by a transcritical bifurcation from an unstable to a stable condition. And then we have another branch of solution, and this corresponds to the heterogeneous tumors, where now we see that as the velocity V+ increases, the tumor mass at equilibrium decreases and eventually crosses the trivial branch by a transcritical bifurcation. And so if we look at how the profile looks, if we are on the left of this graph, you can think about where natural selection dominates over cellular adaptation. And here we have a quite heterogeneous population and profile. So this is the corresponding phenotypic distribution. And as we increase the velocity of the adaptation and this advection term dominates, we see more like steeper and steeper profile as cells accumulate. And in this case, cells become terminally differentiated. And so they kind of eventually die. So you can think about as moving along this V+ axis like almost like a more less disease-like state, less cancerous state. Okay, but then when we look at the hypoxia, what happens is that now we have the differentiation, and now basically what you got is that your trivial steady state is always unstable, and you do have eventually over a long time scale, so here you have to think about equilibria, so very long time scale, you do have the formation of a tumor, which is predominantly form of stem-like cells. These will never occur. It's like, it takes a really long time scale for this to occur, but the idea is that if you were to leave them evolve for sufficiently long time in hypoxia, you're basically selecting for the cells that can survive. Okay, so this is what we get for a spatially homogeneous scenario. We always have just one equilibrium solution, and we do know that we can have extinction in some regime. But how does this translate in a spatially heterogeneous environment that resembles more what we observe in tumor? So here we start again simple. We do consider space, but we reduce the dimension of the problem to a 1D so that it's more tractable by assuming basically symmetry along the y-axis, and we assume that we consider a patch of the tissue where the vessel is located at x equals 1, and we assume that this is kind of symmetric so that we have no flux at x equals 0. And this is a very idealized scenarios, but again, the idea is that we want to use some mathematical tools and techniques that we have to gain insight on the behavior. Okay, so again, we have our space variables. At each location in space, we again describe our cells by this phenotypic distribution that now is going to evolve both in time and space. So we have our equation very similar to before. We do introduce cell movement, simplest way of introducing space in the model. And then we have the oxygen. And now the oxygen diffuses from the vessels into the tissue while being consumed by the cells. So again, we do have our key mechanisms, cell adaptation and natural selection, but we now have also competition for nutrients that comes from the fact that we couple the dynamics to the oxygen. So we can again look at the asymptotic behavior of the model, and we again find that from dynamical simulation, the system evolves to steady states. When we look at both phenotypic and spatially homogeneous steady states, again, we have that the only possible scenario is a well-oxygenated tumor with basically extinction of tumor cells. And the details again are in the paper. The maths are going to be in the paper. But then we want to look at phenotypic heterogeneous tumor, and these are going to be both heterogeneous along the phenotypic axis, but also space. So if now we look at how our bifurcation diagram changes as a function of gamma naught, which I remind you is the consumption rate of oxygen, so competition for nutrients. If gamma naught is 0, we go back to what I showed you before, because basically you have a fully well-oxygenated tumors, which is phenotypically slightly heterogeneous, but you have no spatial component, basically. But now when we increase gamma naught, we do find a topological change in our bifurcation diagrams. So again, we find that we have our trivial steady states here. Oh, this should be 0. Sorry, these are like not in line. We have our trivial steady state who changes its stability via a transcritical bifurcation. We then have a new branch, which corresponds both to a phenotypically heterogeneous tumor, but also spatially heterogeneous tumors. So what you find is that you have two niches, as we saw this morning. The one near the boundary where that is well oxygenated is where like less stem-like cells accumulate. Oh, while in the region within the tumor is where stem-like cells accumulate. That should go the other way, sorry. And then if we look at instead at the other branch, what we find is that is basically our homogeneous type of solution that we saw before. And so effectively by introducing space, we now have some new features in the model. We have, as before, a non-hypoxic tumors with low spatial heterogeneity, which can never coexist with our extinction scenario. But we have a bistability region in which our hypoxic tumor can actually coexist with our extinction scenario. So both of the two scenarios are possible for the same value of parameters. And actually, if we study where this region of bistability, how this region of bistability changes with the value of the parameter, for example, with gamma naught, we do see that it covers a large range of the parameter space, where here we kind of look at several order of magnitude that are biologically plausible. Okay, So this is the end of my first part. And as I said, it's kind of here, the key take-home message is that space really matters. As we saw before, it can drive more complex behavior, most of all if the evolution of your trait variable is coupled to the environment. And now we want to move on to try and understand how our finding translates when we start thinking about treatment, and especially radiotherapy. So the first part is going to be more about how we can use insight of the model to identify some sort of what we can say biomarkers to try and understand treatment outcomes. And the second part is going to be more about using the model to kind of design and test other alternative treatment strategies to see whether we can prevent this stemness, so our resistant cell-driven recurrence. Okay, so now if you think about treatment, most of all, something like radiotherapy, this is administered over a certain time scale. So you can imagine that you're starting from a tumor, which is well developed. So you're in the basin of attraction of your of non-extinction scenario. You apply treatment, and what you're doing, you're basically changing the initial condition of your steady states. And so now the question is like, where is my solution gonna go? Which basin of attraction am I in? And so what we would love to have is a sort of phase space where you say, okay, you have my initial condition, then I have some sort of what we call separatrix, or that divides me from the different two outcomes. But now, if you think even about this model, is a PD, so we are in an infinite dimensional space. So what should this axis be, and how even many axes should I have? So the complexity is very high, but do we need all of this complexity to understand the long-term behavior? So as I said, we have to introduce treatment in the model, and here we use the standard linear quadratic model, which will depend on the dose. But the key mechanism that we introduce of resistance is, first of all, resistance due to stemness. So stem-like cells are more resistant. We have the oxygen effect. So we do know that oxygen itself is needed in order to induce damage in the system, in the cells. And then we also assume that quiescence kind of affects proliferation. So we have different mechanisms of resistance. And now we do have as kind of exploratory, to explore the model, we can kind of start with our initial steady state of these fully developed tumors. We do take a treatment protocol. This is not something you would use on a patient, but basically on a cell line on a tumor spheroids in vitro, and kind of look at what happens, what's the response. And so we apply our treatment, and then here I'm plotting the total number of cells. And as you expect, at each radiation, when you give each radiation dose, you have a jump in your number of tumor cells. Eventually, the mass decreases, but as you stop treatment, the tumor regrows. And so here we are in a case in which we are not able to change the basin of attraction of the system. But there's something interesting that if you look now, it's very difficult to see, but if you look at the composition of the tumor at the end of treatment, you actually have the most of the remaining cells are stem-like. You have few cells. Your tumor is fully reoxygenated because you have killed most of the cells, so there is less competition for nutrients, and you have like an accumulation of stem-like cells. So as we, in some way, we find that repeated doses of radiotherapy is kind of reducing both the spatial and phenotypic heterogeneity within the tumors. And so the fact that we are applying treatment is highly selective for cells, but in some way gives us some predictive understanding of where cells are gonna go. So now we want to understand in some way, not just like how any tumor is gonna evolve over time, but how a very homogeneous tumor, small tumor, will eventually, where it's like a growth dynamic is gonna go. And so now what I'm gonna do is that I'm gonna simulate my model in the absence of treatment, but I'm gonna start from a homogeneous distribution of cells. So there is no dependency on space here. And we do assume that cells concentrate along a certain phenotype S0. And what you're gonna see on this plot is basically how the outcome depends on S0, so the initial phenotypic composition, and the initial mass of the tumor. And so when we do so, we do see, as we expect, that our initial conditions do converge towards different steady state. But what is nice is that by just looking at this two-dimensional space, so the tumor mass and the average phenotypic composition of the tumor, we can actually distinguish between these two outcomes. So despite the dynamics of the model is highly nonlinear, if we look at initially homogeneous tumor, you can have these two metrics as you can just use these two metrics to try and understand the law and predict the long-term behavior of the system. And so what we do is that we start with this function, in high dimension. And then what we propose is that we can look at the tumor burden, and then we can look at the fraction of stem-like cells. So basically you do move back from a basically continuous trait to a more box-like trait to understand the long-term behavior of the system. And so if we look back at our original question, we have a high-dimensional space. How can we predict in this case, which is not a real tumor, but is still like much more complex than a two-dimensional ODE, how can we predict the outcome? Where the idea is that there are two key features that we want to look at. One is the total amount of cells, so the standard tumor burden, as well as the fraction of stem-like cells. So if I look back at the simulation that I showed you before, I was looking at the tumor burden. But as we saw, this is not enough to predict tumor outcomes. And so we can also look at the fraction of stem-like cells. And as you expect, at every dose, whenever you apply radiotherapy, the fraction of stem-like cells increases. But then in between doses, the fraction of stem-like cells within the system is decreasing. This is because of the growth of other cell types, but also because of the reoxygenation of the tumor. So you're actually disrupting the niche of the stem-like resistant cells. And so here we have two kind of competing mechanisms. On the one end, cancer stem resistance drives accumulation of the stem-like cells right after treatment. But treatment is also disrupting the niche where cancer stem cells accumulate. And so eventually, over a longer time scale, the fraction of stem-like cells is going to decrease. And so these two competing mechanisms might make you think about that there might be an optimal way of exploiting this competing effect of treatment in order to drive in order to schedule more effective treatment strategies. And this is where we look now. So the idea is that, okay, we had our treatment, we were applying 10 gray every week. What if instead of applying 10 gray every week, we give more or less time window between the treatments, so this delta tau. And then we apply that for a certain number of cycles, and then we let the system evolve, and we can look at the outcomes. And what we find is this non-linear behavior. So as you move up the y-axis, you're basically giving more of a total dose to your cells. As you move along the x-axis, you're increasing the time in between doses. So before we had 7 days, so we were looking at this vertical line. And so even if you go up to a total of 80 gray, you're always going to get the recurrence. And this is because you are selecting for these stem-like cells. Now, if you increase instead the time window, you do find that eventually, for example, with 80 gray, you can start by waiting 10 days instead of 7, you can start to see that you can have some effective treatment outcomes. But actually, there seems to be a sweet spot where you can actually decrease even the total amount of gray that you're given. And there is an intermediate range that you could say is kind of optimal. And if you look at what is happening, so as I said, we kind of go back at what's the state of our system at the time of treatment, and we project that onto this two-phase space. We do see that the 10 gray every 7 days is very good at decreasing tumor burden, but it does accumulate stem-like cells, and so it's not really effective. So no matter how much you eat the cells, you're just kind of accumulating resistant cells. Now, as we wait longer, we are less effective at decreasing tumor burden, but we start moving along the x-axis. So we are actually able to decrease over time by waiting the fraction of stem-like cells that we are accumulating. And eventually there is a sweet spot in which we cross this boundary. But then if we wait too long, you're basically going to allow your system to regrowth and to recreate an hypoxic niche where stem cells can actually grow back. And so your treatment fails again. And so to conclude, we did see before that space is important in driving behavior that can affect the macroscopic growth dynamics of the tumor. We do see that, we do find that even in our very complex high-dimensional system, treatment outcome and disease progression can be predicted by looking at two key features: the size of the tumor as well as its mean phenotypic composition. And I showed you how we can use this insight to try and give more general principle to design what hopefully are more effective treatment strategies, where this idea of treatment holidays comes back as not only as a way of avoiding resistance, but also exploiting these adaptive dynamics of cells. And with that, I'll conclude, and I'll thank again my collaborators. These are my contacts, the references, and of course, funding the field to be here. And yeah, I'll take any question. Thank you so much.
Questions? Yes.
Thanks. That was a really interesting talk. You mentioned in the middle that you'd have identified possible biomarkers, and you'd got these kind of 4 mathematical expressions, which I thought was a kind of really interesting concept. And I think one of them was the fraction of stem-like cells. Have you or your collaborators thought about any disease or clinical contexts where you might be able to actually measure these biomarkers?
So I guess now with the advancing of single cell transcriptomics also on biopsies, probably this is where like having a stem way of identifying these stem-like cells and counting cells number could actually be useful. And you get also a spatial understanding across your biopsies of both where hypoxic regions are, as well as where these cells accumulate. So there is the possibility. I would say at this point, this is way too theoretical to say anything. I'm not saying that you should go and apply anything of this in the clinic. As I said, this is very theoretical. It's just exploring. If we do think this is the biology that is happening, there are experiments that shows this hypoxic adaptation. These are maybe how you can think about, changing adapt your treatment strategies in order to gain some insight. But yeah, I think with single cell transcriptomics now probably is possible. The real question is how do you identify, I think more a complex question from this point of view is how do you actually define stem-like cells by using this high-dimensional data, which I think is a very interesting question that now is coming. So we do still reduce a lot of the complexity, but there is a lot of debate in terms of what these stem-like cells actually are, because I said it's not like blood where you have a clear hierarchy and differentiation. Yeah.
No, that makes sense. Thank you very much. And really interesting to see how you can identify and apply those biomarkers from a mathematical model.